So you're referring to the H-1B visa physicians that I talked about in my last video. They're actually not required to go to rural areas to stay in this country and work. It's the J-1 visa that has that requirement. H-1B visas are a pathway that employers like hospitals can take to directly hire foreign grads to serve their rural communities. So when you take away the H-1B visa or make it more difficult to get, you're actually decreasing the pool of potential physicians that can work in rural areas and serve those communities. PAs and NPs, mid-level providers, will say, can meet this staffing shortage and help stopgap it and provide care to the population, sure. However, there is a difference in the type of care that you can give to a patient population depending on the provider. NPs and PAs are great. They handle primary care very well. Even those trained within specialty care, I've seen great ones that have done great work and they handle things excellently. However, there is a difference in the level of care that you can provide to a patient population. NPs, for example, have 500 to 700 hours on average of clinical education and training. Physicians, by contrast, have 10,000 hours to 16,000 hours of clinical education and training. So just the differences in our ability of what we can provide to patients is in stark contrast. There was a study published with the American Medical Association that over the course of 3 years looked at emergency rooms at the VA that were staffed by NPs alone. Those VA emergency rooms saw an increased length of stay for patients by 11% because patients were being admitted more frequently than they potentially needed to be. There was also an increase in 30-day preventable readmissions for hospitalizations by 20%. The overall cost increase of emergency rooms increased by 7%, or about $66 per patient, which doesn't sound like a lot. However, if you extrapolate that over the course of the year and say you assign only 25% of emergency cases to an NP in the emergency room, you still get a cost increase of $74 million over the course of the year. Another layer to this is that our rural populations are predominantly Medicaid. With the One Big Beautiful Bill and Medicaid cuts, many of these communities are likely going to lose coverage. That plus our physician shortages will further increase costs to our already broken system. This isn't fear-mongering, this is facts. This is a glimpse into what the state of affairs of our healthcare system in the United States today and potentially what's to come. But thank you for your comment.